Well, hello everyone. I'm Katherine Arthur, your friendly neighborhood speech-language pathologist, and welcome back to Fluent and Fearless. This is a podcast where we help you to learn to speak clearly and confidently. Whether you're in a high-pressure situation, it's a casual conversation, or simply just ordering in a restaurant, if you want to discover how to communicate more effectively, especially if you have concerns about your pronunciation and your presentation skills, well, you're in the right place because I am here to help. I'm at your service. Consider me your personal speech and communication guide through this sometimes messy journey that we call life. So, what is our mission for today? Well, today's episode is for healthcare professionals who speak English as a second language. That includes nurses, physicians, therapists, dietitians, administrators, and many others. Basically, anyone who needs to speak during meetings, staff trainings, case presentations, etc. These are people who are near and dear to my heart, by the way. I've been a medical speech-language pathologist for nearly 20 years now, and I've worked with many medical professionals who speak English as a second language. And I understand their struggle. Presenting to a group of your medical peers is nerve-wracking enough, believe me. And if you speak English as a second language, that adds a whole new challenge. So if this describes you, I've got advice that will help you meet that challenge and overcome it. You've got the potential to become fluent and fearless, so let's do this. So we're going to dive into a topic that scares a lot of people, and that's public speaking. For those who speak English as a second language, workplace presentations can be a real struggle at times. Does that describe you? Do you believe that your ability to speak American English needs improvement? Or do you worry about misunderstandings, trouble being understood, and challenges in your professional and your social life? At Pronounced Speech and Accent Specialists, we understand how these difficulties can result in embarrassment, lack of confidence, and missed opportunities. No more worries for you, though. We have solutions to these problems. Pronounced Speech and Accent Specialists are the experts in personalized accent modification training. We help those who speak English as a second language to refine their speaking skills, boost clarity, and feel confident in every conversation. Remember, pronunciation instruction is not about losing your accent, not at all. It's about helping you to feel more empowered in every interaction, from ordering in a restaurant to giving business presentations to speaking on the phone with your friends. So if you want to speak American English more naturally and more effectively, you can do it. We can help. We can help your voice to be heard and to be understood while you become more confident. And best of all, you can get started for free. Just go to our website at pronouncespeech.com. pronouncespeech.com for all the details. Once again, pronouncespeech.com. Visit our website today to learn how you can become fluent and fearless. Get started for free. pronouncespeech.com. So first of all, hello to all of you wonderful medical professionals out there who speak English as a second language. I'm about to walk you all through some practical strategies to deal with public speaking anxiety. If you feel nervous before speaking at work, your nervousness does not mean that you're unprepared or incapable. What it means is that your body is reacting to pressure, and that reaction can be managed. In fact, when you learn how to control that nervousness, you don't just feel calmer, you actually become a clearer, more effective speaker. So let's take a look at 10 practical strategies to help ESL medical professionals deal with public speaking anxiety, and we'll use real healthcare workplace examples. So strategy number 1, understand that nervousness is normal, especially in a second language. If English is not your first language, you already know your brain is doing extra work. You're choosing words, monitoring your pronunciation, watching the reactions of your listeners to see if they understand you. And on top of all of that, you're trying to stay professional. So, of course, you're going to feel nervous. For example, imagine presenting a modified diet plan during a care team meeting. You're thinking about medical accuracy and language clarity at the same time. That nervous feeling does not mean you're bad at speaking. What it means is that your brain is just working extra hard. So understand that your nervousness is natural. Look at your nervousness as your mind and your body getting you ready to face a challenge. Remind yourself that you're a skilled and educated professional. You have something to say. You're alert and you're ready to say it. Strategy number 2, prepare key messages, not full scripts. What do I mean by that? Well, many ESL professionals try to memorize their entire presentation, and this often increases anxiety. You feel that if you forget one sentence, everything feels lost. At least that's how it feels. You begin to focus on your mistake and not your message, and you may begin to lose confidence. Remember this: audiences are very forgiving, even if you aren't a native speaker of their language. So instead of memorization and perfection, prepare for clarity. Focus on preparing 3 main points, 1 example of each, and then 1 clear conclusion. This will give you a simple and effective structure to work from. For example, you're presenting to your patient and a whole room full of family members an education session about the importance of a heart-healthy diet. During this education session, you can cover these 3 main points and then give examples for each one. So for a heart-healthy diet, you might want to tell these people, point number 1, why the diet is needed. Point number 2, what foods to choose. And then point number 3, which foods to avoid. And then you provide a clear conclusion. Now, this structure will allow you some flexibility and also reduce your pressure when you're speaking. And working with a clear structure will really impress your listeners with your professionalism. Strategy number 3, before that big presentation, practice out loud. So practice speaking your presentation out loud, not silently. As a healthcare professional, you understand that the mind and the body need to work together. This is especially true if you are practicing a presentation. Your mind needs to tell your body what to do during that presentation. That means practicing saying the words out loud so that you can feel and hear yourself say them. It also means having your brain tell your body how you want it to move during the presentation, when to use certain gestures, facial expressions, eye gaze, and that sort of thing. So if you have a big presentation coming up and you're especially concerned about your pronunciation skills, try recording yourself during practice. Have a friend listen to your recording and give you some feedback. Or find someone who can watch you rehearse your presentation. That would also be a great opportunity to work out some gestures and body movements that would work best in key moments of your presentation. Now, if you really have concerns about your pronunciation and communication skills, find a speech and accent modification specialist, like myself, someone you can work with for a few quick sessions that will help you feel more confident about your English speaking skills. This will also help you deal with a lot of the nervousness you might feel right before that big day comes and your presentation is due. Strategy number 4, use breathing to relax your voice. This is something that we medical speech-language pathologists tell our patients. Muscle tension can cause those throat muscles to tighten right up. That's why people may have difficulty speaking when they get really nervous, because that muscle tension can interfere with efficient vocal cord vibration, among other things, and it also results in rather shallow breathing. As a result, your voice can wear out pretty quickly as the muscles just aren't working efficiently, and you use a lot more effort to speak. So here's what to do. For example, if you're feeling nervous before speaking in a meeting, try the 4-4-6-2 breathing method that we talked about last week. What you do is you breathe in your nose for 4 seconds, hold that breath for 4 seconds, then purse your lips, breathe out slowly through your mouth for 6 seconds, rest for 2 seconds, and repeat that about 3 times. Using this breathing exercise will help you to reduce some nervous tension, and it will also slow down your speech and make your voice sound more confident. As a result, you're going to feel calmer and stronger, and a calm, steady voice will increase your listener trust, especially with your patients and with your colleagues. Strategy number 5, ground your body before you speak. If your body feels tense, here's what you can do. Put both feet flat on the floor, relax your shoulders, sit or stand tall, and then gently press your toes into the floor. For example, before giving patient discharge explanations to your team members, grounding your body will help you to sound calm, even if you feel slightly nervous inside. Strategy number 6, use that nervous energy to speak more clearly. Nervous energy can be helpful. It can help you emphasize important medical instructions, speak with intention, and stay alert. So if you're feeling nervous before speaking in front of your colleagues, patients, even your friends, instead of trying to hide that nervousness, focus on clear pronunciation, slight pauses between ideas, and focusing on those key words. Remember, your patients and your coworkers value clarity, not perfection. Strategy number 7, focus on helping, not on being evaluated. When it comes to public speaking, many ESL professionals worry about things like, will they judge my accent, or what if I say something wrong? Instead of thinking about these things, move your focus to, how can I help this patient or colleague understand what I'm trying to tell them? For example, during a staff in-service, your role is not to sound absolutely perfect. It's to share important information that improves patient care. This mindset change reduces anxiety immediately. So when your goal is service, not self-evaluation, your anxiety naturally begins to decrease. Strategy number 8, slow down, especially with medical information. You know, it's tempting to speak quickly when you feel like you're being judged. You feel uncomfortable and you want to get the situation over with as quickly as possible. And being a medical professional means you're already living in a fast-paced world. I know how much pressure is put on us as medical professionals to get the job done and sometimes get it done as fast as possible. But often by rushing, we're doing a disservice to ourselves, our colleagues, and to our patients. That's why when it comes to presenting medical information, both formally and informally, we need to remember to slow it down. For those who speak English as a second language, remembering to slow it down a bit will improve your pronunciation, reduce your grammar mistakes, and make the information you're trying to communicate easier to understand. Strategy number 9. During a presentation, if you make a mistake, just pause and continue, because mistakes happen to everyone. So if you're a speaker of English as a second language and you're giving a presentation, you use the wrong word, lose your place, or forget a sentence, or need a moment to gather your thoughts, just pause, take a breath, correct your mistake if you need to, and then just continue. Calm recovery shows professionalism, and it also shows confidence. So our last strategy for medical professionals who speak English as a second language, build confidence through regular, low-pressure practice. Confidence in public speaking grows with repetition, which means you need to practice speaking. And you can practice speaking during informal, small team meetings. You can practice with just one coworker, or you can practice giving short explanations of things that you need your patients and your colleagues to know. Each successful speaking moment teaches your nervous system that you're safe and you're capable while you're public speaking. Your nervousness, I guarantee it, will diminish, and your sense of empowerment will begin to grow. Over time, controlled nervousness turns into confidence, and confidence turns into clarity, presence, and authority. And isn't that something that we all want as medical professionals? The answer is yes. So remember, when you manage nervousness, you speak more clearly, think more flexibly, sound more confident, and you connect better with patients and colleagues. So if you are an ESL healthcare professional, please remember that confidence is not about sounding like a native speaker of English. It's about being understood. It's about being trusted. And remember, your voice matters, your expertise matters, and your message deserves to be heard. And with that, thank you so much for joining me today on Fluent and Fearless. Please share this episode with a friend or a colleague who absolutely dreads giving presentations. And if you've got some ideas for a future episode, if you'd like to be a guest on my podcast, we welcome you all. Send your ideas and your suggestions my way. Just find us on our website at pronouncespeech.com and drop me a line there. I love hearing from you. So before we wrap everything up, here's something else that I want you to know. If you speak English as a second language and you have some worries about your pronunciation of American English, I am certainly here to help you because I want you to be fluent and fearless. You know you can do it, and I know you can do it too. And remember, working on your speech and pronunciation does not mean that your accent is a problem. It means that you value clear and confident communication. It also means that you're investing in yourself, and you are the most important investment that you can make. By the way, improving your speech and pronunciation is about empowerment. Remember, your voice matters and your ideas matter. And when you're able to share those ideas without hesitation, without worry, without embarrassment, you can focus on what really counts. And what really counts? That's connecting with other people, building relationships, and showing everyone who you are as a unique individual. There's no one else in the world like you. So whether you're looking to succeed in your career or just want to feel more confident in everyday conversations, maybe both, accent modification can give you the advantage that you're looking for. So, are you ready to explore accent modification? Why not visit my website at pronouncespeech.com? That's pronouncespeech.com. On my website, you're going to find all the information that you're looking for. You can also find out how to book a free assessment with me, Katherine Arthur, at no cost and no obligation. Our assessments are a low-key and conversational way to help you learn how you can benefit from accent modification. And you know what? We make accent modification fun. It's like having a whole new friend to talk to. Again, our website, pronouncespeech.com, pronouncespeech.com. So with that, get out there, turn your spark into a flame. This is Katherine Arthur, your fluent and fearless leader. Thank you so much for listening, and join me next time on Fluent and Fearless.